All right, hey everybody, welcome back to Built for Medicine. I'm Dr. Corbin.
And I'm Dr. Madrano.
And today we're going to talk about the top 5 mistakes people make when choosing a medical specialty.
Let's just dive right into it. So, first thing, choosing a specialty based predominantly on money, prestige, some sort of external validation, right? And why this is an issue, right? I know some people, they'll look at the top 10 most paid specialties or specialties where, the most prestigious specialties, the most competitive specialties, whatever it is, right? All that stuff is not going to make it easier sleeping at night, right? If you go into some specialty and you have a difficult case, there was some sort of loss that happened, it's going to be on your mind. All the money, prestige isn't going to make it easier sleeping at night. And these are tough. These are like really difficult situations. So do not choose a specialty only because of that.
And it's one of those things where you're going to be doing whatever you choose to the max. You'll be doing it a lot, especially in residency. If you don't like what you're doing, then number one, it's not good for you, but it's really bad for the patient, right? Oftentimes, patients don't get to choose who they see in the hospital. And so if they're assigned to you and you don't like what you're doing and their care suffers for it, that is a failure from the healthcare standpoint. Mm-hmm. Doing things just for the money and you don't like it, you're going to be miserable. So we really don't recommend doing that. That's the number one mistake we see.
The second thing is something that I really struggled with initially is mirroring your mentors. What do we mean by that? So basically, you're a med student, right? You're rotating, you got this amazing attending that you're with, and they're doing all these incredible things, and you want to be just like them. Like, who wouldn't want to be like this person, right? And you try and mirror their career basically because they're a role model, and that's who you are looking to be, right? And so you end up choosing a specialty because you're having this great experience in this rotation, and you choose a specialty because of that, and then boom, residency comes, and your attending is not going to be there, right? They don't move on with you, right? So you go on to whatever residency, and you're doing the same stuff, and you realize, wow, like a lot of the reason why I really liked that specialty was because of the people I was with, the attending I was with, the mentorship that I got, and now that's gone, and now you're stuck in the specialty at a residency doing the training and really not being fulfilled by it and having a really tough time.
Yeah. Number 3 is going to be pressure from family members. This is huge. You go to medicine, you get into medical school, and wow, you're a doctor. Family loves to talk about it. Some family members may or may not be all that versed in the medical terminology. They may only understand, what a cardiologist is, what a surgeon is, and you pick things that sound great because of what a family member wants you to do. Perhaps you might have a father or mother or a grandfather who was a physician too. You have to do the job. At the end of the day, these are going to be your patients, your responsibilities. Mm-hmm. If you do not like what you're doing, but it sounds cool, or your parents are happy, they won't be the ones doing the thing that you're doing in the middle of the night, on call, day after day. So don't pick things just because it sounds nice or your family members want you to do it.
Another mistake people make, they make a decision based off of limited exposure. So let's say you're a med student, you're doing 4 weeks of surgery, have a blast, right? You're seeing cool cases, residents are cool, and you decide, okay, I had a great experience, I enjoyed it, this must be what I was meant to do, or this is the path for me, right? And you choose that specialty, and then come residency, you realize after 6 months of doing the same thing that you really don't like it. And this actually happened to me with surgical rotations in medical school. I really, really loved it for like the first 8 weeks. I did an additional 6 more weeks, and after like week 12, I was done. I was ready to step away from it, and I'm glad I made that choice.
The next thing we want to talk about is outdated advice. This is huge, right? Unfortunately, in medicine, the way things were 10, 20 years ago, some of your more senior attendings that are on services, it's not the same for you. It won't be the same as you go through, as you experience your attendinghood. So when you get advice from someone who's been doing something for 30 plus years as an attending, it can be complex when you hear what their advice is and it doesn't match what your personal life is. So you really want to match the context of what the person giving you the advice has at that time and what you're going through currently. Because especially as you get closer and closer to the end of the road, it starts to become very personalized. Do you have loans? Did the person giving you advice have loans, right? Was that person married? Are you married? Do you have children? Did they have children? Did they come from an affluent family? Do you come from an affluent family? Do you want to continue to do this indefinitely for the rest of your life? Do they want to do that? Do they want to retire early? Like, so all of these different things, when you're starting to think about what you want to do, try to match the advice from the people that are doing the thing that you want to do in the same context.
And understand this isn't only coming from mentors. We understand that people, administration who are helping medical students apply to residency, they're also kind of giving them at times some either bad advice, outdated advice. So we understand some of you are experiencing that, and just to be aware of that.
Okay, bonus tip, number 6, not considering the numbers. We talked about the prestige, we talked about money, we talked about external validation. When you're picking a subspecialty or a specialty in medicine, you also have to consider the hours worked, what you're going to be getting paid, why you're getting paid, what you're going to get paid. You know, for radiology, we have what's called a relative value unit. It's assigned to each individual scan. That's what it's worth. If you read a certain amount, that's what you get paid. That's why you get paid. There's no magical number of why you make what you make. It's a one-to-one relationship. You read the scan. Currently, you know, we have this particular fee structure that might be shifting in the future, but you read the scan, you get paid for the scan. You read a lot of scans, you get paid a lot. In surgery, it's similar. You do the procedure and it's worth a certain amount of money. You can add on different things, but you have to understand how much time you're going to be spending and what you're going to get paid. And it's important because medical school is more expensive now than it ever has been, ever. And so while you shouldn't pick specialties for the money, you do need to recognize to your particular situation. If you're at extremely expensive medical school and you want to do primary care, if that's what you love, go for it. But understand that the salary that you get paid may not, within a reasonable amount of time, be able to pay off your loans. Mm-hmm. So it's just things you got to consider.
And you didn't even mention malpractice, right? Be competitive of that specialty in a certain city. Maybe you have to go to a rural area now because the cities are saturated with certain specialties. All we're saying, consider all these elements to your career, make an informed decision based off of those things. You can't just look at a finite number of aspects that matter and add value to you, right? You gotta look at the big picture.
And we say all these things because ultimately what we want to foster is people who are in medicine that are happy. They're happy with the decisions that they made. They're happy with the choices that they made. They're taking good care of patients. And some of the best attendings that I've seen are happy taking care of patients. And it doesn't matter about the money or the prestige, but they're happy doing what they're doing and their patients love them. And that's what we want to see moving forward. If you found this video helpful, valuable, please like, comment, and subscribe. We really appreciate it.
And also look for part 2 of this video.